Okay, I hope everyone can hear me all right, because there's a couple of comments earlier on the chat that I saw that I wasn't coming through very clearly. So I'm hoping I'm coming through clearly now and everyone can hear me all right. So I'm going to talk you through the stages of labour. There are sort of essentially what we call 3 stages of labour. The first sort of stage of labour, it's important to sort of note the time and to stand back and quietly observe the process. We only want to interfere with the mare when she's foaling if there is a problem, because actually if you get too involved in the process, sometimes that actually is distracting to the mare and prevents her from getting on with her foaling, because the mare's instinct is to, you know, want to foal on her own. You know, they're a prey animal, and so their instinct is to foal when they're quiet and there's not too much going on. And so, you know, it's important for your mare, although it might be really exciting and everyone wants to watch your mare give birth, ideally when she is sort of starting in the first stages of labour, don't invite all your friends and a crowd of people to come and stand around the stable and watch her foaling, because that is quite disturbing to the mare. So essentially the first stage of labour is the foal repositioning itself and readying itself for birth. Some mares may show absolutely no signs whatsoever, and others will show quite a lot of signs. First stage labour can last for, you know, minutes, minutes to hours. You know, some mares will only sort of show a few signs and then we'll crack on with foaling. Others, you know, will, you know, for the night, you know, before foaling, can be quite restless and show quite a few signs. This is where it can be quite useful when you have been watching your mares on your foaling cameras, because I've certainly had a lot of clients who have never ever foaled a mare before, but when they've been watching on the cameras, that the mare gets very established in her routine, that she likes to, you know, eat her hay net at this time of night. She likes to stand over in this corner of the stable at this time of night. She likes to sort of have a little lay down at 9 o'clock at night. But that night when she's going to foal, the mare will usually, you know, sort of show, you know, a change in her routine. And that might be, you know, that she's restless, that she's walking the stable, she's sweating, looking at her flanks, getting up and down. One sign that, you know, quite often sort of see is that they will be, you know, furiously itching their tail. You know, that they sort of keep rubbing their bottom, you know, on their hay net or on the sides of the stable. So essentially this picture is just sort of showing what the foal is doing, that when the foal is normally sort of lying in the uterus, it is sort of lying in an upside down position. And in this sort of first stages of labour, the foal starts to rotate itself into the position to sort of give birth. And if you just sort of, this is sort of this bottom sort of corner slide on the right there is worth sort of noting that as the foal sort of comes out, it sort of has to dive sort of, I guess, through the mare's pelvis. And it's important to sort of note, I guess, the curve of the mare's pelvis and the curve of the foal's back, because this is sort of important later on if we're needing to assist the mare with giving birth. And I'll talk about that a little bit later. So second stage labour is the real start of the excitement, and it's what we've all been waiting for. This is the point where the mare is committed to giving birth. In first stage labour, if the mare becomes distracted or feels unsettled, if there's too much of a crowd of people watching her, the mare can sort of stop the labour process. However, once the mare sort of starts into second stage labour, they are committed to giving birth. And it's important time to, you know, to note the time, because this stage of second stage labour in most mares only takes about 15 to 20 minutes. They give birth very quickly compared to other animals. The start of second stage labour is sort of signified by the passing and breaking of the water bag. And you can just sort of see in this picture over here, it's a little bit in the sunlight, so it's not hugely clear, but you can see that she's got this sort of white bag hanging out the back of her vulva. And so that's sort of, when you sort of see those white membranes turn up at her vulva, that's the start of second stage labour. Most mares sort of lay down for second stage labour, but occasionally you will have some mares that will foal standing up. I think that often sort of sometimes happens when, again, they don't feel sort of settled enough to lay down. So if the mare's not laying down, it's worth trying to, you know, minimise the number of people are about and try and keep things really quiet, and not have people snapping photos on their iPhones and things like that, because, you know, flashes and things like that are disturbing to the mare. Second stage labour is the, you know, it's also signified when the mare's sort of lying down, that they get the onset of full abdominal contractions. And you'll see this sort of later in a short video that I've got, that when the mare contracts, her legs become rigid and the top legs sort of lift off the ground. You can sort of see, again, in this picture, a clear sort of picture of this white membrane at the mare's vulva. And we'll discuss sort of later why we keep sort of talking about this white membrane, because it is quite an important thing to note and to heave a sigh of relief when you see the white membrane. So fairly quickly, we get, you know, both front feet and the nose should appear in quick succession. When the other sort of, when the, you know, feet sort of appear, like you can sort of see in both of these pictures, initially it is actually quite normal for the feet to not be exactly together. And this is actually an important way of the foal kind of having one shoulder sort of behind the other, which sort of narrows the foal's shoulders as it comes through the pelvic canal. But occasionally, as the mare continues to contract, you can sort of see that one foot is getting steadily further behind the other one. And occasionally you can get the foal's elbow sort of sticking on the edge of the pelvis. And so if we get beyond this sort of point here where we've just got the feet slightly asymmetrical, that this front leg is kind of getting out to the point of the sort of knee, and you've still only got the foot at the other side, sometimes we do need to grab this foot that's kind of getting left behind and give it a bit of a hoik to get the elbow off the pelvis. It's also, you know, quite important to note and to not panic that it is quite normal for the mare to get up and down frequently during this process. And it's actually a quite important thing for the mare to do, because sometimes we'll have the foal coming sort of slightly upside down or sideways. And actually the mare getting up and down and even occasionally rolling is a very important process for helping to rotate that foal into the correct position. So again, don't panic if your mare is getting up and down and having the occasional roll, but obviously we've taken note of the time at the beginning, and if we're kind of pushing on to kind of 20 minutes and we haven't got progression, then that is a concern. But initially, getting up and down is a normal process. So here, sort of once we've got I'd actually say in this picture that the membranes have perhaps been cleared a little bit early, but once the head is sort of completely passed from the mare's vulva, you can, you know, if the mare is settled enough for you to do so, you know, get in there and just sort of clear the membranes away from the foal's nose. And as I sort of said, you know, if we've got one front leg getting left behind the other one, then you can give the legs, the leg that's getting left behind, a bit of a pull to kind of get both legs sort of straightened out. I guess this is sort of, you know, an important sort of point as well, that if we've got to a point where we've clearly got two front feet and there's still absolutely no sign of the nose, or we have one front foot and the nose and no sign of the second foot, or we have a foal's nose and no sign of the feet at all, then these are signs of a potential complication and a problem. And certainly, if you have any of those scenarios, then you should definitely be calling your stud vet and sort of advising them of the situation, because, you know, we would much rather that you called and we can be getting in our car and getting on our way. I would much rather be called out and be on my way, and then for you to call me back and say, it's all right, everything's okay, the foal's out, than you waiting too long. The other thing is, as well, is if you ring us, even though it's going to take us a while to get to you, sometimes we can advise you over the phone on what to do. And you can actually, with our kind of guidance over the phone, and fortunately with us all having mobiles now and hands-free, we can kind of be talking you through the process quite often while we're actually driving to you, you know, to hopefully arrive and see a healthy foal. But if there is a problem, we're at least on our way, so we can get to you as soon as possible. So further straining should deliver the shoulders, the chest, and the hips. You know, careful assistance may need to be given. So sometimes, as you'll sort of see in the little video later, you'll see that each time the mare strains, she gets the foal to a certain position, and when she relaxes to take a breath, the foal slips back to the same point that she had got it to before. And so sometimes when you're assisting the mare, you're not even necessarily pulling to get the foal out. What you can just do is just hold on to the foal's legs so that you kind of hold the foal's position for the mare. So when she relaxes in between contractions and tries to take a breath, that the foal doesn't kind of slip back to where it started from. The other point to sort of note is, you will see in this picture here, when I was talking at the beginning about the way the foal comes out in an arc over the mare's pelvis. If you are assisting and sort of assisting the mare by pulling the foal out, it's very important that you're actually pulling the foal in effect, I guess, a downwards direction, that you're pulling the foal out towards the mare's hocks, because actually if you pull the foal directly backwards out from the mare, you're actually making the foal go straight against the arc of the mare's pelvis. And so again, the foal's back is going straight. And so that actually makes it much more awkward to pull the foal out, because the body shape of the foal is sort of arcing in the wrong direction to the body shape of the mare's pelvis. So if you are needing to assist, you want to sort of position yourself down towards the mare's hocks here, and so you're pulling the foal out towards the mare's hocks so that it sort of follows the arc of the pelvis. Once the foal is out, it's quite normal for the foal to lie with its hind legs still inside the mare, and the mare will usually lie and rest with the foal sort of, you know, with the foal's hind legs in the mare. This is actually quite an important time for blood to return to the foal from the placenta. So once we've got the foal out to this point, and it's probably made a little nicker, it's sort of starting to make sort of reflex movements to sort of right itself and try and get itself into a sitting up position. Again, if everything looks normal, it's really important not to kind of rush in and crowd the mare at this point, because again, if you rush in too much to do things around the mare at this point, that will often kind of stimulate the mare to get up much quicker. And if she gets up quickly, then that umbilical cord will break quickly. And so the foal won't get its sort of full quota of blood sort of coming back from the placenta. So if everything looks like it's going normally, the mare's, you know, will often lie flat on her side for a while, just panting. Sometimes I sit up like this mare to kind of look at their foal, is just stand back and quietly observe the process. So this is essentially the end of second stage labour. You can sort of see in this picture here, the umbilical cord here is still attached to the foal and still in the mare. The mare's looking around and looking at her foal, and the foal is sort of starting to struggle itself into a sitting position. If the mare is continuing to rest, and some mares will stay lying down for, you know, 10, 15, even 20 minutes after foaling. You know, certainly some maiden mares can be a bit shocked after foaling, and it's quite an exhausting process. So it's not uncommon for them to stay lying down. Normally they will kind of bring themselves into a sort of a sitting up resting position. But yeah, it's not uncommon for them to lie for a longer period of time. If the mare is continuing to rest and the foal has usually in their struggle, moved further away from the mare and their umbilical cord will have broken, you can sometimes gently move the foal around a bit so the mare can reach it and she can sort of start to lick and nuzzle the foal. While it sort of sounds a bit rough to do so, if you need to actually move the foal because it's got itself in a dangerous position or an awkward position where the mare's going to potentially squash it when she stands up, or you're just wanting to move it where the mare can reach it, the easiest way to move the foal is actually to grab hold of both front legs, and actually you pull it by its front legs, but you let it sort of roll, the foal sort of roll onto its back. And that way you can kind of drag the foal to a better position without dragging their umbilicus on the bedding, because if you sort of drag the foal sort of with their tummy side down, that can make the umbilicus sort of start bleeding again. So it's just sort of a little tip. Again, if you try and pick the foal up from around under its tummy, that can sort of squeeze its tummy and sort of make the umbilicus sort of start bleeding again. So if you need to move the foal just a short distance, grabbing hold of both front legs and letting the foal sort of tip sort of onto its side or onto its back is a safe way to kind of move the foal from one place to another. So I'm going to show you a video now of a mare foaling. It's a little bit dark because it is from a few years ago, and also again, initially you don't want the stable necessarily too bright because again that's a bit distracting to the mare. But you can see this mare here has the white membranes hanging out from her vulva, and I guess the thing to note with this video as well is that it's only actually about 6 minutes long, but when you're watching your mare foaling, it seems like it's been hours. So again, it's an important reason to note the time of the start of second stage labour, because sometimes you feel like it's been going on for ages, but it's actually only 10 minutes. And so it's not actually time to panic. So you can sort of see in this video that the mare, gets up and down. She's up again now. Those membranes are sort of broken, so they've released some of the fluid. Some mares will actually stop and have a little pick of their hay while they're foaling as well. So here shortly we're going to sort of see the mare do a contraction where you'll sort of see her top legs lift off the ground. When she's sort of straining there, that her legs become rigid and lift off the ground. So she's having abdominal contractions. And you can sort of see again that the mare's tail is nicely bandaged up, which is very useful to keep the dirty old tail out the road when the mare's trying to foal. It also means if you need to assist the mare at all, that the sort of fetal fluid covered tail is not being wiped through your face. You just notice in this bit of the picture here, you can see that these foal's feet are actually pointing sideways. So this foal is actually at the moment coming sideways, but you'll note shortly after the mare gets back up again that actually her getting up and down has actually started to rotate the feet around, and the foal's feet now, just when the mare turns her rump around, the feet now are pointing the right direction. And so this mare has actually corrected her foal's position by getting up and down. So don't panic about the getting up and down. It's a normal process, and it's important for the foal positioning. So you can see here in the picture, we've got two front legs that are reasonably symmetrical, but one's a little bit behind the other, and the foal's nose here. And you can sort of see what I mean here, that the mare's straining, but each time she relaxes, the foal kind of slips back to the same spot as where she'd sort of squeezed it out to. So if your mare's been doing this for a little while, and she's not kind of getting the foal to progress, sometimes what you can just do to help her is just hold the foal's position. So, you're not necessarily pulling, but when she strains the foal out, you just sort of hold the foal's legs so it doesn't sort of slip back to the starting point when she takes a breath. So here they're just sort of assisting this foal with sort of coming out. just pulling by the legs and pulling down towards the mare's hocks, so the foal's sort of arcing out, clearing the membranes away from the foal's face, and then now it bottom shoots out, and we leave the hind legs sitting in the mare. You know, this mare is an old experienced mare, so she's sort of used to sort of people being around her when she's foaling. But you can see now she's reaching around and sort of licking her foal, but that umbilical cord here is nicely still attached, and the foal's feet are still in the mare's vulva. So again, if the foal's doing what this foal's doing, it's sort of rolling itself up into a partial sort of sternal position. This is a good time to just stand back and just quietly monitor the process and don't interfere with this, this sort of important sort of bonding stage. So you can appreciate, how long this sort of process sort of does sort of take when, this is only a short video. So here the foal has sort of moved itself around by trying to sort of move. And so again, if your mare's lying down quietly, this is a really good opportunity to nip in and tie the placenta up. Katja will talk later about why it's important to tie the placenta up, so I won't sort of go into detail at the moment, other than, if at all possible, try and tie the placenta up before the mare, so the mare doesn't stand on it. And again, during this process, just if at all possible, if the mare's doing the right thing and the foal's doing the right thing, just stand back and observe, and don't interfere. Don't, especially with a maiden mare, try not to go rushing in with your cameras and trying to take photos, because it is quite disturbing to the mare and can interfere with that bonding process. So occasionally, sadly, things do go wrong. As Grace sort of said earlier, it's actually kind of less than 10% or, around 10% of mares' pregnancy, foalings that can result in complications. And because the mare's, that second stage labour is so rapid that it's literally from the start of second stage labour to the finish is only about 20 minutes. So, while most of the time things go right, if things do go wrong, they go wrong very, very quickly. And so this is sort of where, just setting your alarm and checking on the mare every hour, while it's better than not observing the mare, it still gives a lot of opportunity for things to potentially go wrong in that hour between one check and the other. So, with our own mares, when we're foaling them, we use a combination of sitting up with watching the cameras, milk testing kit, foal alarms, because I think the more ways you can monitor them, the better. So look, when things go wrong, as I discussed earlier, sometimes if you haven't got 2 feet and a nose, then ring us or ring your vet, depending on where you're listening from, and advise them that you're concerned that you've only got 1 foot, 2 feet and no nose, etc. And often we can give you advice over the phone. But sometimes, unfortunately, things do come presented the wrong way, and because the mare's contractions are so vigorous and strong, sometimes the only way that we can try and manipulate that foal to get it in a better position is under a general anaesthetic. And so, as you can sort of see in this picture, while it looks a bit unpleasant, this mare is actually anaesthetized, and we're using the hoist that we normally use to take the mare into surgery to hoist up her hind legs, which means that the abdominal contents sort of fall away from the pelvis, because the mare's anaesthetized, she's not straining, and that can often mean that we can reposition the foal in order to get it out through a normal vaginal delivery, rather than needing a cesarean. Rarely cesareans are required, but fortunately they're relatively rare. It's worth noting, certainly for people listening in the UK that have pet insurance or their horses insured, a lot of the insurance, if you've got a competition horse or a previous riding horse that you have insured and you've decided to put them in foal, I guess a couple of points is to make sure that you notify your insurance company that she's now that she's now a broodmare. And a lot of the insurance policies, it's only sort of an extra 50-60 pounds supplement on your insurance policy to provide cover for foaling. And so while that won't cover any sickness or illness in the foal, that will cover you if your mare retains her placenta, or if she needs to have a cesarean or something like that. So for those of you that do have horse insurance, it's worth sort of speaking to your insurance company to sort of see whether what sort of cover you can get just in case. So red bag sort of presentation. So this is something that's kind of been asked a number of times, and you can quite clearly see in these two pictures how different what we're seeing here looks from the nice white membranes that we've seen earlier in the presentation. And so if we get a red bulging sort of membrane at the mare's vulva rather than the white membranes, then that means that the placenta is separating and it's coming out sort of with or before the foal. This is an emergency because essentially the placenta and its contact with the uterus, as Katja will explain later, is the foal's oxygen supply. And so if the placenta is sort of separating as the foal is being born, it's rapidly losing its oxygen supply before it's actually got out far enough to be able to breathe for itself. And these membranes as well are quite thick, and so usually the foal can't physically break through these membranes themselves. And so this is where, if this birth is unsupervised, sometimes people will find the foal that's been born and it's dead and completely still within the placenta, and so in effect the foal has suffocated because it hasn't been able to get out through these membranes. So if we get a red bulging membrane at the mare's vulva, this is an emergency. We need to get this foal out as quickly as possible. You should get somebody to ring your vet, your stud vet, to get them on their way to you as soon as possible. You need to try and tear through these membranes. Now, sometimes you can just do it with your hands or your fingers. Sometimes you do need to actually cut the membranes with some scissors. And then once you're sort of through the membranes, is to feel, for the foal's feet and the nose. And this is certainly a delivery that, with our guidance over the phone, that we would get you to kind of assist the mare. And so that sort of means that once you've got the 2 feet and the nose, that each time the mare contracts, that you pull with her to try and get this foal out as quickly as possible. So as the mare contracts, you pull with her to try and get that foal out with the in the minimum time that we can. The umbilicus is another thing that people often ask us about. Is the umbilicus should break at a natural weak point. So again, you can sort of see nicely in this picture that this umbilicus is still, attached in the mare, and there's sort of a weak point sort of up here close to the foal's abdomen where that umbilicus will normally break. And normally, if the mare and the foal have been lying there sort of nicely for a nice period of time, usually where this umbilical breaks, it seals itself and it doesn't bleed. Occasionally, or if the mare gets up very quickly, the umbilicus will bleed. And if the umbilicus is bleeding, the best initial way of treating it is with a clean gloved hand. So that'll be one of the disposable gloves that you'll have in your foaling kit ready to go, that you just between your finger and thumb, just manually hold, that the end of the umbilicus sort of clamped between your finger and thumb. And usually, if you're able to just to hold that clamped for sort of 30 seconds a minute, most of the time that will stop it from bleeding. And then you could then sort of treat it with an antibiotic wound spray, such as amidazole or chlorhexidine solution, You shouldn't use Hibby Scrub because Hibby Scrub has actually got a detergent in it. But again, if you're not sure what to treat the umbilicus with, you know, speak to us. We can provide you with a wound spray, or for those people that are not in the south of England, you know, speak to your own stud vet and they can advise you what they feel the most appropriate treatment is for the umbilicus. Ideally, we don't want to clamp or cut the cord. Very rarely we have umbilical cords that are very thick and just don't break. Now, sometimes if they're not breaking, you can with your hand sort of hold the umbilicus here with one hand and, you know, basically, I guess, hold the umbilicus near the foal's abdomen between your two hands and then try and sort of pull the umbilicus apart between your hands. You don't want to pull away from the foal's abdomen, so you want to use one hand to hold the umbilicus at the foal's abdomen, so we're not pulling it too close to the foal's abdomen, and you can kind of make the umbilicus break. Very rarely, you know, it needs to be cut, but ideally we don't want to do that. There are umbilical clamps that you can put on umbilicuses that keep bleeding, but again, we try and avoid it because cutting the umbilicus or putting clamps on the umbilicus does seem to significantly increase the risk of the foal developing umbilical infections. But again, if the umbilicus keeps continuing to bleed after you've held it clamped, you know, for a minute with your hands, then sometimes we have no choice other than to put a umbilical clamp on it. But as I said, if at all possible, we try and avoid that. The third stage of labour is the expulsion of the fetal membranes. Again, you see this mare with them nicely tied up. I'm not going to go into this in any depth because Katja is going to cover this in the next talk. Occasionally, the mares might show a little bit of mild sort of colic and pain, and the placenta should be passed within 3 to 4 hours of birth. So just as I guess as a quick overview, you know, stage 1 of the labour is the relaxation of the cervix and the pelvic ligaments. There might be some early mild uterine contractions. The mare will be might be sweating, restless, show mild colic, frequent urination, and they might be sort of starting to drip milk. The normal duration is kind of 30 minutes up to 6 hours, but certainly some mares can be showing sort of mild signs of first stage labour. You know, sometimes I've had them for up to a day ahead of foaling, that they're restless and things. But occasionally also you will get some mares that don't show any signs at all. So no sweating, no restless, no colic. So there are always some that catch you out without showing any signs. Stage 2 of labour is, you know, the fetus being passed and the foal being born. This stage on average is about 20 minutes. You know, anything longer than 20 minutes I would be getting concerned about and would be definitely getting on the phone to your vet to, you know, to discuss what we've got presented and how the mare is progressing. And then the final stage of labour is the passing of the placenta, which again usually happens within 30 minutes, but should be passed within 3 hours. And then after that, it's time to hopefully, you know, sit back and enjoy.
So thank you very much, Paula. That was a really good, informative talk. I think there's a huge number of questions that have come in. I think a lot of them, I think people were anticipating what you were going to say, and I think you answered a lot of the questions during your talk, which was good and indicates how comprehensive it was. There was one question I specifically wanted to ask you, and that was, and someone raised this question, and in view of the fact that I actually foaled the mare, I wanted to know why you said it, and that was, this was the question: why did you think the membranes were removed too early from the foal that was foaling on one of the slides?
I out. And, you know, I have had foals sort of in that position that when the mare sort of stands up to reposition herself, that the foal sort of slips back in again. You know, so yeah, I guess it's a personal sort of decision, but you know, I like to kind of feel that the foal's at a point where it can't sort of slide back in again. And usually at that sort of point, because their rib cage is still within the pelvic canal, the foal is not actually, you know, taking, you know, breaths at that point, because their chest is kind of in compression going through the birth canal.
That's great. That's good. That's told me what I've done wrong. Thank you very much for that. Just with regards to the foal slipping back in between the mare's contractions, I mean, you've talked at great length about your method of delivery, which I totally agree with. One person asked the question, if the foal slips back in, are you concerned of infection being introduced back into the mare's uterus?
Look, I think the foal sort of sliding in and out, that's, I guess, one of the good reasons why we recommend that mares foal on a clean straw bed, because straw is, you know, obviously if the bed is nice and clean, and straw, you know, is sort of larger kind of bits, and so it doesn't kind of tend to stick all over the foal, you know, when the mare's sort of lying down. Whereas when mares are foaled on a shavings bed, and the shavings are quite dusty and floaty, that the shavings do sort of get stuck onto the, you know, every time the mare sort of lays down and gets up again, the more and more shavings get stuck onto the foal, the fetal membranes, and around the vulva. And so, yes, I think, you know, with inappropriate bedding, there is a risk that, you know, dirt and stuff can be, you know, taken back into, you know, the mare's uterus. However, I guess usually any of that content will subsequently get expelled again when the placenta is passed after foaling. So yeah, so hopefully if anything is sort of taken in, it is passed with the placenta, but it is an important reason why we recommend foaling mares on a clean straw bed.
That's great, thank you. One question that was quite interesting, what are your thoughts on giving painkillers to mares after they've foaled?
Yeah, look, I think it depends a lot on the individual mare, and that this is sort of, I guess, a point where if you know your mare, like mares that have had sort of several foals, you know, yes, they might show some mild discomfort post-foaling associated with sort of passing their placenta, but most mares are sort of so focused on their foal and what their foal's doing, you know, they don't seem to show a great deal of discomfort. However, you know, certainly, you know, some mares, you know, on the studs that I look after, we do have some mares that we know are obviously a little bit more pain sensitive than others, and so there are some mares that we know do get quite violently colicky associated with the uterine contractions associated with passing the placenta, and so there are some mares that we do routinely give you know, an injection of pain relief, and certainly sometimes you know, maiden mares, I wouldn't say that I necessarily you know, give them sort of pain relief immediately post-foaling unless they are showing signs of, you know, significant kind of colic and discomfort with passing the placenta. But, you know, quite often when we sort of do the foal check the next day, I find maiden mares will often be quite swollen around the vulva post-foaling, and that I think that sort of swelling around the vulva and being quite sore around their back end obviously can deter them from wanting to strain to pass droppings, and kind of can predispose them to getting constipated post-foaling. So I will quite often give maiden mares an injection of an anti-inflammatory or a painkiller, when I do the foal check, to make sure that it helps that swelling go down and encourages them to keep passing droppings. And also sometimes maiden mares can get a little bit sore in their udder associated with the foal sort of starting to suck and things. And so, a bit of pain relief can often help there as well.
That's a great answer. Thank you. Another one that I think is an interesting question. Have you ever experienced mares that have needed assistance with their labor in consecutive years? Basically, the question was whether the mares were regarded as being lazy. I just wonder what your thoughts are on that. I do have a bit of an answer I might give in a minute.
I would say absolutely. Certainly on the studs where we've got mares that we have foaled down recurrently over a number of years. We do have some mares that literally, I remember one particular mare that she would, go into second stage labor. She would lay down, kind of make half a grunt as a contraction, and then jump up and start nickering and searching around the stable for her foal. And wouldn't actually make much effort to get the foal out at all. So we certainly do have some mares that literally kind of go into second stage labour and just lie there and wait for the stud hands to try to pull the foal out. And then other mares that we know are quite vigorous foalers and work really hard and put a lot of effort into getting their foal out. So I would certainly sort of say that I think mares that we'll foaled recurrently often do have patterns to how they foal. They have patterns to the signs that they show before foaling. They have patterns to the way the way they do foal, and certainly on the studs they keep a record of what time they foal, when their waters break, all that sort of thing. Because I think even the time that the mare foals is off. Some mares like to foal during the day. That you'll have a mare that that recurrently kind of foals in the daytime. So certainly knowing a mare's previous history and what she's done, how she behaves, can be very helpful, because I think they do very often follow patterns.
I've made an interesting observation. I've had a couple of mares that have had what I believe to have problems with their necks, that we've had repeated incidences of needing to assist them during foaling. And I wonder, they've got this reflex called the Ferguson reflex, which is where they present with the foal in the birth canal, and the actual presence of something in the birth canal makes the uterus contract, makes the mare makes the mare contract with abdominal contractions. And it would appear that some mares don't get that reflex, or their reflex is very, very weak. And I do wonder if it's something to do with their necks. I have a couple of horses that I know that have had neck problems, and I've certainly made that observation. So whether or not that is a genuine thing or not, I don't know, but that would be an observation I've made. I'm going to ask one last question, which it's just somebody's asked the question about the assisted delivery under general anaesthetic, so manipulation under general anaesthetic in the second stage labour. Would you ever consider doing that anywhere other than in a vet hospital?
Yeah, look, I think that decisions need to be made according to the facilities available. Some of the yards that depending on so I guess some of the clients that we sort of go to can be up to an hour away from the practice. And so if we are looking at a foal that's badly positioned, if we are looking at loading the mare up and taking them into the practice, by the time that's all been, I guess by the time we've driven out to the mare, determined that the foal, we can't get the foal out, loaded the mare up, and then got it into the practice, potentially you're looking at, at least a couple of hours after the stage of second stage labour. And so certainly, you're most likely looking at a dead foal, and that you're doing it to save the mare. So certainly if I get out to a property and we have a foal that is, incorrectly positioned, and the foal, from what we can determine, is still alive, then there certainly may be circumstances where it's appropriate to anaesthetize the mare at the property. And I certainly have, when people have had the appropriate facilities, anaesthetized mares at the yard and used, an appropriately sized tractor to basically to hoist up the mare's hind legs, so that we've been able to reposition the foal at the yard and get the foal out alive. However, it's important, if you're going to attempt to do this, that people have an appropriately sized tractor. I'm sure we've all seen these horrific, videos on the on Facebook and things, where people have been using tractors or cranes or things and trying to lift and move things, and the tractors or the crane or the HIAB or whatever have toppled over. And so it's very important to be aware of the weight of a mare, and if you are going to if we are going to try and hoist their hind legs up with a tractor at a yard, it has to be a decent sized tractor. It can't be just your little yard tractor, otherwise you could be causing more danger than good. And also sometimes trying to reposition the foal, it's also if we're going to attempt to do it at the yard, I would only sort of do that if I thought it was something that could be fairly easily corrected. For example, I've got one leg and a head, but we've got a foot back, that quite often you can kind of reposition that fairly quickly and easily and get the foal out. Because the problem you need to consider is, if we anaesthetize the mare at the yard, try and get the foal out, and we can't reposition it, then that then means we have to wait for the mare to wake up, to then load her on a lorry, to then transport her into the vet practice, to then re-anaesthetize her in order to do a cesarean. So, I think that if I felt that the foal was dead, then it is probably best for the mare and safest for everything to just get the mare on the lorry and get her into the hospital, so that we can try and reposition the foal under a general anaesthetic. If we can't reposition it, then we can proceed with a cesarean straight away, and we're not having to anaesthetize the mare twice.
Okay, once again, a very comprehensive and detailed answer. There's lots of questions coming about red bag deliveries and to do with placenta